Hi there, my name is Dr. Fox. I'm one of the veterinarians and practice owners here at DePorre Veterinary Hospital. I am here to talk about leptospirosis today. We think it's a really important disease and want to make sure that your pet is protected. Leptospirosis is a bacterial disease that we worry mostly about in dogs and something that they can pick up from the environment. The way that we worry about dogs having exposure is typically from standing areas of water or areas of soil that are more wet or have been contaminated with standing areas of water. The way that we worry a dog would have contact would be either from going outside and drinking from a standing area or puddle, stream, creek, slow moving water, or if they walk through puddles and they have open sores on their feet, that is how the bacteria could also get absorbed into their system. The disease causes them to go into liver or kidney failure. And so obviously it can be very serious and sometimes deadly in dogs, something we take very seriously. The disease typically will show up for pets either not eating, very lethargic, sometimes vomiting, sometimes diarrhea, sometimes drinking a lot of water, or changes in their urination habits. And so all of those are kind of reasons that they need to be seen right away. Most dogs with leptospirosis are pretty sick. These are dogs that are clearly something's wrong. The challenge with lepto is that until you start running lab work and doing further testing, it can be difficult to diagnose until you can rule out some other things. And so getting an answer can take a little bit more involvement in terms of testing. It's really important that people are aware that this is a disease that can be passed to people from their animals. You want to be extra cautious with handling any bodily fluids. They're vomiting and you're cleaning it up, wearing gloves, urination, things like that. Unfortunately, it can cause people to go into liver or kidney failure, and so something that we want to be extra cautious with. We do have a vaccine that can protect against lepto. It protects against the 4 main strains of lepto that we see in the area. So it is an important thing, and we recommend for all dogs to be vaccinated. Really typically starting as puppies. It seems like puppies understandably are out there getting their nose and eating and drinking things that they shouldn't outside. So getting puppies vaccinated as soon as we feel like it's safe to do so, and also still being cautious, even with vaccinated dogs, of not allowing them to be drinking from standing areas of water, ponds, puddles, things like that. Back in the day, it was given standard with the distemper parvo. You didn't even know your dog was getting vaccinated for lepto 20, 30 years ago. At that point with the vaccine, they were seeing higher incidence of vaccine reactions. And so the lepto vaccine got a little bit of a bad reputation. And so what happened then is they separated that vaccine out, and then a lot of dogs were not getting vaccinated for lepto. And what we found is that we had started seeing all of these smaller dogs that were just living in people's yards actually starting to get sick with lepto. And so the vaccine recommendations have changed a lot, and is now part of our core recommendations for vaccines for all dogs. The vaccine itself has also changed significantly over the years, and now there is no statistical relevance that a lepto vaccine has any higher incidence of a vaccine reaction compared to any other vaccines. And so sometimes people will still question that. Sometimes breeders are still questioning. And it's really just a conversation between you and the veterinarian that you're seeing of what your patient's risk factors are, as well as what we feel is the safety of the vaccine. So leptospirosis being a bacterial infection, the big concern we see is it's being transmitted through wildlife. And wildlife meaning rodents, squirrels, possums, skunks, raccoons, other dogs. The rat population is actually one of the big things that you worry about. So even some of the local, more city areas, that can certainly be an issue with those areas of wildlife shedding that bacteria through their urine, contaminating different areas of soil or puddles that then your pet has exposure to, and ingest the bacteria through that. Most of the time we see lepto peak in the spring and fall with the weather conditions that we have here. So want to make sure that people are extra vigilant during those times of years, but should be cautious all the time. If we do have a leptospirosis suspect patient, the treatment is typically aggressive antibiotics. The response from the bacteria generally is pretty good with antibiotics, but the concern and where this disease can be so devastating is a lot of these patients are so sick that they need hospitalization, sometimes 24-hour care for IV fluids and supportive care and medications to really help their organ function improve and get them feeling better. One of the misconceptions I think with leptospirosis is that this is kind of a hunting dog, or big dogs that are out in really rural areas. And we are seeing more and more of it in our area. And my worst case of leptospirosis, which was 10 years ago, was a small Westie that lived in our Bloomfield area and just went into the backyard. And that dog went into severe kidney failure and ended up making it through after having to have dialysis done to improve the kidney function. So it can just be the small house dog that doesn't have a lot of exposure outside of your yard. If you have any further questions, we're always happy to answer them here at DePorre Veterinary Hospital, and want to make sure we're doing what we can to get your pet protected as well as keeping your family protected.